Here, I'll hold her. Yeah. All right, let's talk about gallbladder disease. Thank you. You did a good job holding your hand. Yeah. All right. Gallbladder. Where is the gallbladder located? Right underneath the liver, because it's its wife, right? So it's in which quadrant? Right upper quadrant. All right. What's the gallbladder's job? To store and release bile. What's bile's job? To emulsify fats, which means to mix it with water. So that way when the intestines absorb the water, they can pull the fat with it. Yes? All right. So there are two gallbladder diseases we're going to learn about today. First one is cholelithiasis. Second is cholecystitis. Now I want to be clear on something really quick. Okay. If you see this, what does this mean? COL. That means the colon. Where's the colon? That's your large intestine. Yes? If you see this, CHOL, that equals cholesterol. That's your gallbladder. Oh, but yes, cholesterol is part of it. That's your gallbladder. Or you may also see cholecyst. Cholecyst means gallbladder. Y'all with me? Sorry, my handwriting's gonna be bad today. Okay. With a baby. My handwriting is obviously very good. Yeah. All right. So work through this name. Chole, CHOL, gallbladder. What is lithiasis? Stones. Because what was nephrolithiasis? Y'all had that in last test. That was kidney stones. So anytime you see lithiasis, that means okay. So cholelithiasis with the CH, gallstones. All right. So gallstones. There's two big different types of stones. Okay. There's pigment stones, which are made up of excess bilirubin, and then there's true gallstones, which are made up of excess cholesterol. Okay, now cholesterol, very good for our body, unless you're eating it all freaking day, every day, and the bad type of cholesterol. Do we understand? Yeah. Okay. So risk factors. Risk factors for cholelithiasis are your F's and your C's. I had to get creative, so don't make fun of me. Okay. Female. Now, fat is rude. I shouldn't have said that, but it's enough. Okay, so female, which means they're overweight, right? Female fat, they're in their 40s. And fertile usually means that does not mean they're fertile now because they're in their 40s, so chances are probably not. But that means they've had lots of babies. Okay, a fatty diet, low fiber diet. Now, a high fat, low fiber diet is the number one risk factor for like every GI bad thing that happens. It's the number one risk factor for like colon cancer. Like, it's bad. Okay. Now, fat is not bad, right? I want to be clear on that. You have to have fat. Fat is great for you. It's a great source of energy. It also is good for your noggin, right? But when you're eating, if that's all you're eating and you're eating no fiber to move it through, then yes, that's going to be very hard for your gut. Okay. So back to the F's. Female fat, fertile, 40, fatty diet, low fiber, high rate of family history, fair skin. Okay. Cirrhosis, if you have a history of cirrhosis, which makes sense because if Big Daddy mad, gallbladder mad. If you have a history of Crohn's disease, what's Crohn's disease? It is an inflammatory bowel disease. It is an inflammation of the whole entire GI system. So what happens when this is super swollen, almost to the point where it's shut? It pushes against this duct. This duct goes right to the, yeah? Okay, so that can give you gallstones because anytime your bile is just sitting in your gallbladder and it's not working correctly, right, it can form, yes, stones. All right. Sickle cells. Anybody know what sickle cell is? Okay, well, could you tell me about it? All right, so red blood cells become misshapen. If they get stuck in one of the vessels by the gallbladder, that can cause the gallbladder not to release. Okay, and then contraceptives. Y'all will know how I feel about birth control. Okay, contraceptives put you at high risk of gallbladder disease because they're hormones. Hormones are metabolized by and the liver cannot metabolize all the hormones that are in birth control. So if Big Daddy's mad, gallbladder's gonna be mad too. Also, one of the functions of estrogen is to help you get rid of your cholesterol. Okay, or to manage cholesterol, I guess I should say. When you're taking a ton of estrogen, it can't even keep up with that. So you just get a ton of cholesterol leading to gallstones. So is it just like oral contraceptives, or can it also be like any other hormonal ones? It's any hormonal contraceptives. Now, if it's progesterone only, it's not going to be as bad, but they hardly ever give anybody progesterone only unless you're breastfeeding. Okay. All right. Signs and symptoms. So where do you think that gallstones hurt? The right upper quadrant, because that's where it's located, right? They may also have upper back pain because y'all realize anytime you have an organ, it's in the front and the back, right? Because it's inside of you. Okay. Referred shoulder pain. They love to test on this. If a female says that they have shoulder pain, that should always red flag you. There are 3 conditions that can cause shoulder pain in women that are not good. Number 1, MI. Number 2, gallstones. Number 3. I'll set you up with the presentation. You have a 24-year-old female complaining of unilateral pelvic pain and right shoulder pain. You should automatically know what that is. Do you want to guess? No, it's not kidney stones. It's not UTI. Y'all, unilateral pelvic pain. I'm sorry, unilateral left-sided pelvic pain. Is your bladder on the left side of your pelvis? I should already know what this is if I gave you that presentation. What'd you say? Pelvic inflammatory. Oh, no, probably not. Because that would be across the whole abdomen, right? I thought you said HIV. I was like, damn, you just gave that girl HIV. Huh? Would y'all like me to give you more information? Maybe you can figure it out? No, that's a good guess, but it's not that. Because those can't kill you, right? They hurt like hell, though. Do you want to try? No. It's okay. Go ahead.
I'm like trying to think if you're like a quad or something.
That's not a clot. Okay, so you are an ER nurse. Okay, you have a 24-year-old female patient that comes in. She has had severe unilateral lower left pelvic pain for 4 hours. It is a ruptured ectopic. It is a very nice. So anytime there's unilateral pelvic pain and it's a woman of childbearing age and she's got shoulder pain, that usually means she has ruptured an ectopic pregnancy. That is an emergency. She will be septic and hypovolemic and go into shock like that. So y'all need to be very clear on these big presentations. Y'all should be putting these on your red flag sheets. Do y'all still have your red flag sheets? Yes. You need a red flag sheet. Okay. So what the red flag sheet is for those that haven't been coming here. The red flag sheet is stuff that we put on that's like, this is always on test, a giant red flag. It's always a priority. Like rigid board-like abdomen. What does that mean? Peritonitis. You're going to report it 100% of the time, right? Okay. So shoulder pain in a woman, big deal, yeah? All right, then. She's going to have nausea and vomiting. Like this is very, very painful. And it's blocking all of the ducts where all the enzymes can go through to break down her food. Yeah? Indigestion, bloating. Why is she itching? All our liver patients itch. And if gallbladder angry, Big Daddy angry, okay? Steatorrhea. You heard this one before. Is Big Daddy mad? And so if you can't get the bile out because there's a stone in there, then what happens to your poop? It's going to get fatty and frothy, and it's going to come out, just floats in the toilet. It looks like just big chunks of fat. Jaundice. Why would this patient get jaundice with gallstones? Is Big Daddy mad? Liver's mad, so he's not going to be able to get rid of all of that, yeah? They come in so much pain that they're sweating, okay? Now, the biggest complication of gallstones is pancreatitis. Why? They're all connected. You piss off the gallbladder, you're going to piss off the pancreas, because gallbladder has this common hepatic duct, right? Common hepatic duct that connects to the cystic duct, goes to the gallbladder. This duct connects the gallbladder to the pancreas. So if there's a stone right here, don't you think the pancreas is going to start getting a little angry? Do you understand? All right, how are we going to diagnose this? Well, I can do an ultrasound so I can see like, oh, there's a stone. Yeah. If I can't see it because some of them are small, I'm going to do cholangiography. What does CHOL mean? Gallbladder. Angio. Vesselography. Pictures. I'm going to take a picture of all the vessels and ducts in the gallbladder and find that stone. You with? All right, treatment. If they have no symptoms and we accidentally caught it, like maybe you're doing a CT for something else, you're like, oh, you have gallstones. They're like, that is shocking. Are we going to do anything? No, because I'm not going to operate on somebody who has no symptoms. Yes? If they are symptomatic, we're going to go in, take it out, which is so stupid because you absolutely need your gallbladder. Never get your gallbladder removed. Y'all hear me? Okay, it'll ruin you for life. All right, that happened to you. All right, so they will do a cholecystectomy. Okay, what's a cholecystectomy? Take out the gallbladder. We also can do an ERCP. Anybody know what this is? I will write it on the board, and then y'all have to break down the words and tell me what it is. Deal? Deal. Okay. I'll try to write it next. So I had to pause for a minute. All right. Endoscopic, which means, so they took when I tell y'all that means a camera tube inside your mouth. Okay. Retrograde. Behind, they're going behind something into the gallbladder, vessels or ducts, into the pancreas, and they're taking a picture. So they're looking with the camera and they're looking at the ducts and the vessels between the gallbladder and the pancreas, and they're coming up from behind this way. That's easy to break down. See, when y'all know words, it's so much easier. Okay, that's an ERCP. Okay? You with? I can go in there and get them that way. Okay? All right, next, you can do a medication called ursodiol. Okay, if you see it on exam, this is the brand name because the generic name is like hemidinic acid. So if you see something on your exam that says hemidinic acid, that is ursodiol, and its job is to break up your gallstones into smaller pieces so you can pass them. Okay, and then your other option will be ESWL. Y'all learned about this in renal. What is ESWL? Extracorporeal shock wave lithotripsy. So let's break that down. What does extra mean? Outside, corporeal, the body. So it's outside the body. This is not invasive, right? Shock wave. Remember, you tase them. Okay. Litho. I've already taught it to you. Lithiasis, stones. Thank you. Tripsy. Break it up. So we are tasing the patient from the outside and breaking up the stones into smaller pieces. They can pass it. Yes. All right, nursing care. Don't look at your page. What kind of diet do you want to put this patient on? Low fat and low cholesterol, right? Because they probably have a cholesterol stone. Okay, cool. Do you want them to exercise? Yes, move around. If you move around, like your gut will start moving too, right? You want their BMI less than? Okay, what else do you want to increase in their diet to get their gut moving? Fiber, lots of fiber, and fluids, yes? But they're like, oh, I'm so nauseated. You're like, okay, here's a antiemetic, like ondansetron, metoclopramide, promethazine. Very good. All right, we need to manage their pain. If they're acutely in the hospital, they need opioids. If they're not in the hospital, what would you give them? What would you not give them? Okay, you'll give them NSAIDs because NSAIDs kill the stomach and the kidneys. Acetaminophen kills your liver. So none of these liver patients can we give acetaminophen. Yeah. You can give them NSAIDs. We haven't broken their kidneys yet. All right. Why in a patient with cholelithiasis do I need to monitor their amylase and lipase? Yes, but what's the biggest complication of cholelithiasis? Pancreatitis. And what are your pancreatic enzymes? Amylase and lipase. Do we understand? All right, let's go to cholecystitis. Itis means inflammation. What does cholecyst mean? Gallbladder. So it's inflammation of the gallbladder. Biggest risk factors is females with gallstones. That was easy, right? Where's the pain? When does it hurt the most? After they ate a bunch of fat. Because what happens when you eat a bunch of fat? That tells your gallbladder, give me a whole bunch of bile. Well, it's trying to, but it's angry. So that's going to hurt really bad after you eat a high-fat meal. Do you understand? Because it's really mad. You're going to see all the same signs and symptoms. Tell me if this sounds familiar. Nausea, vomiting, dark urine, steatorrhea, fever, anorexia, jaundice, clay-colored stool. ALT, AST, and alk phos, bilirubin will all be high because those are our liver functions. See how easy this is when you know the liver? I'm already done almost. All right. Biggest complication. Pancreatitis, because the gallbladder is connected to the pancreas. What do they do when you have cholecystitis? They just yank it out. Yeah, that's what the medical community is. If your organs go bad, they just yank them. We sort of needed that there, you know? All right, what kind of diet? Low fat. You want to increase their fluids? Yes. You want to increase their fiber? Yes. You want them to exercise? Yes. You want a BMI of less than 25? Yes. You want to monitor amylase and lipase? Why? Complication is pancreatitis. Okay, you want to give them something for the pukey puke? Okay, do you want to watch their stool and make sure that it goes back down to normal? After they have a cholecystectomy, because they do it laparoscopic, which means they make teeny tiny incisions, they stick this big giant, what looks like a knitting needle inside to go and pull it out. Every time they shove that in there, they're shoving in air. So after a cholecystectomy, every patient will be like, my chest hurts. You know what it is? Yes, we need them to tote. Okay. So if a patient after a cholecystectomy is like, I'm having chest pain, what do? Do you do an EKG? No, we're like, get up and walk. You need to fall. Okay. Yes. Do you understand cholelithiasis and cholecystitis? Moving on.